This story is about my introduction to Narcan, which is a drug that kind of brings people back from the dead. It brought my sister back. That's Jenny. Narcan's used when someone overdoses on an opioid. These are drugs like heroin or prescription pain meds like morphine, Vicodin, or some you probably haven't heard of, like Deloitte. When a person overdoses, their heart slows down and their breathing slows down, and it becomes really hard to wake them up from this state. So what Narcan does is it blocks the opioid and it reverses the overdose. And I didn't know any of this 6 months ago. I'm not someone who has struggled with addiction. I'm not a doctor. I'm not a social worker. I'm just someone's sister who was drafted into the front lines of the opioid epidemic earlier this year when I got a call at work telling me to come home, that my sister Jenny was in the hospital and had just been revived with Narcan. I fly home that day, and within an hour of landing at the airport, I am helping my sister shuffle to the bathroom at the hospital because she can barely walk. I don't know it yet, but Jenny will die in just 6 days from cirrhosis of the liver, from alcoholism and opioid addiction. She's just turned 44 years old. She's never done any rehab, no interventions, and my family has not had a single conversation about addiction. I am completely blindsided. Everyone in this room knows someone who has died or is struggling from addiction. More than 175 Americans die every day from overdose. More than half of those are from opioids. I share my story with you today so you're not blindsided like I was, and you don't make the same mistakes that I did, because these are mistakes that I'll regret the rest of my life. So here's my story. I'm a very good problem solver. I work at the US Digital Service, which is a technical startup in the White House. We were started by President Obama in 2014, and we're going strong in the Trump White House. We're about 200 engineers and designers from companies like Google, Apple, Amazon, and Code for America. We sign up for 2-year tours with government to work on complex problems. That's me in the middle. And I joined the digital service because I wanted to help veterans, mainly because my dad is a Vietnam combat veteran and a Bronze Star recipient, although he'd never tell you that. Here's my family. We grew up in Buffalo, New York. I'm the oldest of 3 sisters. We all went to college. My sister Colleen is a nurse and lives here in Saratoga with her family, with her husband and 3 kids. And my sister Jenny is sitting in front, and she stayed in Buffalo, and she was a stay-at-home mom. She lived a middle-class suburban life with her husband of more than 15 years and their 2 kids. My parents will celebrate their 50th wedding anniversary next year. They are hardworking, humble, and very private people. We go on sister vacations. Our last one was Key West, and Colleen likes to sleep in, so Jenny's stuck being my workout partner. And you can see neither of us has any idea how to do yoga. And we see each other regularly. I would describe Jenny as smart, athletic, funny. She had a quick sense of humor. But about 3 years ago, I started thinking she might be drinking too much because I was noticing her hands were shaking, she had started to stutter, and she was becoming more and more reclusive. 2 other things were happening at that time. She had surgery to relieve some back pain issues, and she and her husband started going through a stressful separation. But when I tried to talk to my sister about her health, she was very defensive. She insisted she had the best doctors in Buffalo, which she did. She assured us that she had stopped drinking altogether, and we never saw her drink. And she said she was just taking Xanax for some anxiety. So we accepted this. We thought that sounds okay, and we trusted that she was in good care. And that was a really big mistake. And the minute I got that call this past July, it all clicked, and I knew all my suspicions were right. But at that time, I still thought, it's going to be okay. We have years ahead of us to help her battle addiction. And so as I headed home, I brought a blank check, and I started looking up private rehab facilities in New York State. So when I arrive at Kenmore Mercy Hospital, as I'm walking down the hall, I can hear my sister before I see her, and she's moaning for something, that opioid, Deloitte. And when I walk into her room, Jenny is radically transformed. I am not expecting this. Her legs are bones. Her skin is an awful jaundice color, and she has these clear liquid bubbles all over her eyeballs like a monster. She's in and out of lucidity, and she never stops moaning. For 3 days, Colleen and I sleep at the hospital. Every night, we have to get up about every 45 minutes to help Jenny shuffle to the bathroom. And I think this is the hardest part for me, because it's so sad watching her look up from the portable toilet when we can't make it to the regular bathroom. She's embarrassed, even in her end state. For 3 days, I put drops in my sister's eyes, I try to feed her Ensure, and I rub her swollen feet. We're a close family, but we are not affectionate at all. But that week, I remember holding my sister's hand a lot and touching her hair. And I don't think I ever remembered touching my sister's hair before. And now I feel it all the time on my right hand. So on day 4, her doctors come in and pretty abruptly tell us we need to start making some decisions, that my sister's dying from liver failure. But they say this like we've been expecting it for years and we already know it, and we don't. So then things start going very quickly. Do not resuscitate orders get signed. We move down the hall to a hospice room, and for the first time in my life, I see my mother visibly shaken, although I've never seen her cry. Jenny dies 2 days later. So in my reality, my sister has just died from cirrhosis of the liver, from alcoholism and opioid addiction in just 6 days. But in reality, she'd been dying a long time before that, right in front of us. She'd been drinking and taking prescription drugs from the best doctors in Buffalo for years, and this culminated this past year with her going to her local emergency room to get generous doses of Deloitte. She lied to us for years, and while my heart is broken, I am so angry. Mostly I'm angry at Jenny for not getting the help she needed. I would have done anything for my sister, she never asked. I'm angry at myself for not being more educated about addiction, but I'm also really angry at all those doctors who kept giving her medication and a system that is broken at every level and plagued by silence and denial. I hope no one you love ever has to endure this system, because this is what they're in for. Imagine someone you love is addicted to prescription pain meds. 21 million Americans have substance use disorder, yet just 1 in 10 get treatment. So say you're one of the lucky ones. What I learned was addiction treatment was intentionally set up to be completely separate from mainstream healthcare and mental health. This was before we understood the science of addiction. So the specialty treatment and meds that you need are not going to be covered under your insurance, or there's going to be a wait list because there just aren't enough resources in the system, or your doctor isn't even licensed to prescribe the meds you need. Less than 10% of American medical schools, including nursing schools and pharmacy schools, have a single class in addiction to train our healthcare professionals. But say you're lucky, like our family, and you can afford one time to pool your resources for a private facility. Those average more than $30,000 for just a 30-day program. But you have an opioid addiction, so that's not going to work for you. You have a chronic brain illness, and you need medication-assisted treatment, just like someone with diabetes, hypertension, or asthma. So the one-size-fits-all abstinence-based treatment isn't going to work for you. But you complete your 30 days, and now you have to get back to your real life and manage your disease. And in order to do that, you have to drive an hour every single day to a clinic to get your meds, because again, there's not enough resources in the system. These are probably some of the reasons why more than 80% of people who struggle with opioid addiction relapse. So you relapse. But this time you can't get prescription meds, so you start taking heroin, and your nightmare begins all over again, but this time in the criminal justice system. And this is the good news. This is the 1 out of 10 people who gets treatment, remember. My sister was part of the 9 out of 10 people who didn't get treatment. And she insists till the day she died, no doctor ever talked to her about addiction or drug screening. I don't know if that's true. I do know that none of her doctors talked to us, her family, about addiction. And even if she did get treatment, I don't think she would have survived that mess. The thing that's the most infuriating about all this is that the awesome and dedicated healthcare professionals and researchers in this country already know how to fix this. We need to embed evidence-based treatment in mainstream healthcare. This means treating opioid addiction as a chronic illness, just like diabetes, hypertension, or asthma. It means routine drug screenings. It means faster access to care and medication-assisted treatment and disease management. So things like the Affordable Care Act essential services are part of how we fix this problem. My sister didn't need a slick advertising campaign or some condescending slogan like just say no or don't do drugs. She had a chronic illness and she needed medication-assisted treatment. It'd be a very cruel thing to tell someone with asthma just breathe, but not give them an inhaler. We know how to fix this. We just need the political will to do it. So as I was preparing for this talk in Washington, D.C. in our digital service office, I was thinking about all the posters and inspirational things we have up in our space, and you'll recognize the popular Margaret Mead quote, "Never doubt that a small group of thoughtful, committed citizens can change the world," because it's the only thing that ever has. But there's one poster that always kind of scared me, and it's this idea that no one's coming to fix this. It's just us. And that's how I feel with my sister's story. When I read the news or listen to our elected officials, no one's really coming to fix this. People are talking about moving in the right direction, but no one's actually doing anything. Or at least they're not doing it fast enough. So what can we do? Well, as thoughtful, committed citizens, we can all demand that our elected officials do their job and implement solutions that work for patients, not big pharma and not drug wholesalers. By the way, those stakeholders are doing just fine in this crisis. So what that means is a small town like Kermit, West Virginia, with 392 people, should not have one pharmacy that over a 2-year period received 9 million hydrocodone pills. We can all be advocates in our professional roles as well. So if you are out there and you work at a medical school, we need more classes on addiction in your curriculum. If you are out there and you're a judge, start a drug court in your community. If you work in Congress or you're a lawmaker, we need to support the Affordable Care Act essential services, and we need to strengthen agencies like the drug enforcement agencies, the DEA, who fights against illegal opioids entering the country, not weaken laws because of pressure from lobbyists. If you work in health policy, we need to embed evidence-based treatment in mainstream care. If you work in an insurance company, make sure your company is complying with parity laws and stop denying addiction treatment claims because you're legally supposed to cover those. If you work in a hospital, adopt the 8 national principles of care. If you're a teacher or you work in a school health office, focus on prevention and early intervention. Give kids accurate, up-to-date scientific information about substance use disorder. And if you're a doctor, we need to remove those barriers so you can actually prescribe people the medication they need. If you're in government like I am, fight from the inside for the right solution. As family members and loved ones, don't make the same mistakes I did. Get educated and be aware. If you have a hunch something's wrong, it probably is. So talk to your family honestly and be supportive. Ask your doctor questions, and parents talk to kids. It's been 4 months, and every day I wake up, and I can't believe one of my sisters is dead. That week in July, I tried to say goodbye to Jenny and all the things. I love you, I'm sorry. Give me one more chance, and I'll do a better job next time. But there's no second chance for me, so don't make the same mistakes I did. Thank you.